a cage for a cat. Have blankets within the cage. You want to make sure that you have the proper label for your cage card. This is Kovu. We're going to safely stick him in the cage. And then we want to make sure that he's latched in there so he can't get out. And Kovu is a really nice kitty, so we need to open up and be able to transport him safely to the exam table. Alright, so today we're going to be demonstrating getting Kovu out of the cage. Kovu is really a nice kitty, but if he was aggressive, we would make sure that we have a towel in hand, and we want to safely open the cage, have towel ready, and then safely stick it over top of him, pull him out. Make sure you have him secure in your hand right here and up against your body so no one gets bit or scratched. Alright, so today we're going to be demonstrating a kitty burrito. So you want to make sure you wrap them up in tightly. Claws are in so nobody gets scratched. And he's securely wrapped in. And then if for some reason he decided that he wanted to bite, you can apply a nylon muzzle just right over top of his nose and secure it safely behind his ears. Alright, so today we'll be applying an e-collar here on Kovu. If Kovu had any wounds or sutures or anything that we didn't want him to lick or bite, we would be applying an e-collar so he cannot get a hold of it. So we want to put it safely over his head. And then I'm going to tie it. And you want to make sure that you can fit 2 fingers underneath so it's not secured too tightly on him. Alright, so today we're going to be clipping Kovu's nails. So he has pretty long nails here. We're going to use the little clippers for cats. And you want to clip right before you see the pink, if you're able to see it on clear nails. If for some reason you go past that and make them bleed, you'll use Quick Stop. Stop it from bleeding. And we're going to do his rear leg here. Just take off the tips. Okay, so today we're going to be demonstrating holding Kovu here for a physical exam. If you want to make sure you hold right where his neck is and have control of his head. You don't want to scruff him just in the case that can make things worse. But if he does become aggressive, then we will scruff if need to be. Alright, so and then if we were going to do an exam on his eyes and ears for the doctor, we just have his head secure. Alright, so today we're going to be doing some oral medication. This is Kovu. For demonstration purposes, we are using plain water. But if you had a medication, you want to make sure you have the proper medication and actual dosage for him. So, and then when you are trying to administer the medication, you want to make sure you get it far back in his mouth so he's able to swallow everything. You want to go in the corner. Alright. So today we're going to be holding Kovu here for a jugular draw. Stretch him out. I'm just going to stick. I'm going to hold off. And then next we're going to put him in a position where we can pull for his cephalic vein. So I'm going to roll. And she's going to stick. I'm going to hold off. And then next we're going to put him in a lateral stretch. And then hold him so then Ashley can pull for a femoral blood draw. And then I'm going to hold off. Alright, so today we're going to be doing a full TPR here on Kovu. First we're going to check his pulse. And he's got a nice strong pulse going. Alright, and his pulse rate is at 182. So next we're going to check his respirations. They're at 32. And then next we're going to check his gum color. He's nice and pink. And he's pink in one. Alright, so now I'm going to apply a probe cover for the thermometer. I have some lubrication. Check Kovu's temp. And while we're checking, we can tell that Kovu is a boy because of his scrotum is right beneath his anus, and there is a penis present. I'm going to stick in the thermometer. We're going to wait until we hear the little beeps go off to state that it is finished. His tip is 999. Alright, and then next we are going to check his skin hydration, and we're going to pull his turgor, and see how it bounces back. He's well hydrated. And then next, Kovu does not have a microchip, but if he did, you would just press this button and it reads it and puts the little number on top to match. But if you were to check to see if Kovu has a microchip, you would just scan between the shoulder blades and then back here in the rear and go side to side. Alright, so today we're going to be cleaning Kovu's ears here. We want to make sure that if there was any hair that you would pluck it to get it out of the way, but since Kovu doesn't have any, we don't need to do that. We're going to apply a couple drops to his ear. You want to make sure you squish it around. And then take your cotton ball, swab out the dirt. And then once it's all clean, we're going to apply some Monconazole ointment. I'm going to do a couple drops in there. Alright, and to clean Kovu's other ear, we're going to wrap him in a towel. We're going to do the same thing. We're going to apply a couple drops ear cleaner. Where'd your head go, buddy? Make sure we swish it around in there. On this side, we're going to use some Q-tips. We want to make sure that we don't go too far to go into the ear canal and rupture his eardrum. And then once it's all clean, we're going to apply the same ointment into his other ear, just a few drops, and swish it around. Today we're going to be doing a subcutaneous injection here on Kovu. Before you do an injection, you want to make sure you have the proper dosage and calculation. And for demonstration purposes, we were just using sterile water. So you're going to pinch your little tent. And then you want to pull back to make sure you're not getting any blood, and then inject. Alright, so this is Kovu here, and he has been diagnosed with ringworm right here. We don't need to clip or shave because there's no hair. Apply some gloves. And then here on my tongue depressor, I have some antifungal ointment. So we're just going to apply it right on his site.